Good afternoon. I'm Karen Barnett, the Dean of the Nursing Program at St. Vincent's College. We're going to talk about critical thinking today and why it's so important to your chosen field of nursing. If critical thinking is so important to nursing, you might be saying, what exactly is it? There are several definitions of critical thinking, including the one on your screen. Critical thinking basically tells us that we should reflect on the thinking process that we are using. Critical thinking plays an important part of being accountable as a nurse. Critical thinking should be used before taking action. You may be familiar with the nursing process. The nursing process plays directly into critical thinking. It includes questioning, assessment, interventions, and evaluation. Critical thinking can be used in all aspects of your life. Everybody uses it. In fact, you used it to choose your nursing program. Now let's talk about why it's important to your chosen career of nursing. Critical thinking is essential to nurses because they deal with complex situations every day. Nurses are responsible for the unique dimensions of healthcare and for the healthcare of individual patients. Reasoning and reflection are needed to determine what interventions to use, determine whether they worked, and if not, to figure out why. Critical thinking is important because each client is unique. Their individual differences make it impossible to have strict rules for client care. Nurses must evaluate and modify care to be sure they are appropriate for the individual. What are your responsibilities as a nurse? You must consider each patient individually, including other health problems, and anticipate complications. For example, if a healthy 9-year-old fell and broke his right arm, he would experience pain and discomfort and may have to eat with his left hand. He will be discharged home with his caregivers, and the nurse would focus on teaching the caregivers the appropriate care for the patient. The adjustment would be quite different for an older adult who has had a stroke that limits the use of his left arm. An injury to his right arm would severely limit his ability to care for himself. The nurse would focus on assuring that the client has the care he needs at the hospital, and her initial care would include assisting the client with eating, bathing, and toileting. Each client is different. In order to provide care, you must begin to think critically. Critical thinking includes a number of different skills. Mental operations are important. Decision-making and reasoning. Knowledge is collecting facts that you're going to use to help make the decision. Attitudes are important too. Attitudes are more like feelings and traits of mind. Determine if you will use your critical thinking skills fairly and always have an open mind. Critical is an important part of essential nursing skills. It must be careful, deliberate, and goal-directed. Check your assumptions and biases. Observe carefully and collect data. Stay positive and persistent, and show concern for accuracy. Take all the time you need before concluding. One quality of a good critical thinker is the ability to ask on-target questions. There's a list of questions on the screen that may help you to establish your critical thinking skills. When you don't ask questions, you sacrifice your own learning. Consider both the positive and the negative. Use examples to support your thinking. Seek out data. Read articles that present both sides of an issue. Then you'll have sufficient data to make a good argument that leads to a strong and valued conclusion. Reflection is an important part of the critical thinking process. How you solve a problem is as important as the solution. Reflection allows you to think about how you made your decision. It gives you insights into yourself and into your practice. These new insights help you to respond to similar clinical situations that may occur in the future. The goal of reflection is to improve your critical thinking skills by reviewing in detail the situation, your response, and the outcome. It's an opportunity for you as the nurse to think about your thought process, how you reached your conclusion, and whether or not it was valid. The most valuable technique for doing that is the written narrative. It lets you analyze the situation more clearly. The written word is powerful. Don't be afraid of it. Using open-ended questions to guide your reflection is a great way to improve your critical thinking. Ask yourself, what do I know? What are the gaps in my knowledge? And what did I learn? Over time, reflection will help you to enhance your critical thinking skills, your nursing skills, and your confidence. Critical thinkers are flexible, non-judgmental, inquisitive, honest, and interested in seeking the truth. They have the intellectual skills that allow them to use their curiosity to make decisions. Remember, critical thinking skills are essential in nursing. They help light the path to safe, quality nursing care. Thank you for taking the time to learn more about critical thinking, and I encourage you to access websites, articles, and textbooks and continue your learning.